For me, the reasons that brought me to come and participate in the program were basically to see what's new in the field of education, what is new in the field of maternal and child health.
أنا عارفة الكونديشنز عندنا ازاي في مصر وده أنا أقدر أحور السيستم هنا وأخليه ينفع السيستم المصري.
I solemnly pledge to uphold the standards of my profession. You're gonna be okay. I will devote myself to the welfare of my patients.
And constantly endeavor to increase my knowledge and skills and to use them wisely. I'll remember that I'm a loyal member of a team with special obligations to all my fellow human beings.
May I always act to preserve the finest traditions of my calling, and may I long experience the joy of healing those who seek my help.
هذه قصة بعض الناس يعيشون في مناطق مختلفة من العالم، وبالرغم من اختلاف الجنسيات، اللغة والديانات، إلا أنهم جميعا لم يختلفوا في مبدأ واحد: المعنى والهدف من القسم وأهمية هذه الرؤية من معنى وهدف الإنسان.
You can do good work from anywhere. We work on 5 continents. Yeah. We work in women's issues in Kyrgyzstan and conflict prevention issues there. We work with disability people in education and disability in Ukraine and in parts of Russia. We work in Indonesia with youth and with religious leaders. We work now in public health in Morocco and in Egypt. So we work all over the world.
Yeah, all over the world. Yeah.
We're all over the world from Bedford, Virginia.
I am one of the 2 directors that this project has. I am the director in charge of the training and development of the community health internship fellowship.
You can give him IVs. You can do an IO. It actually goes right into the bone.
It's a very exciting opportunity to reach out into North Africa, particularly Morocco and Egypt, and use this U.S. government initiative funds for bringing healthcare professionals who specialize in marginalized areas, rural areas, as they pertain to mother and child health. And we are using Roanoke, Virginia as our small city/rural area to show the fellows the models that we are using in the United States.
We have a control room right here that we're actually behind, and it's obviously you can't see in there, and we can see out. And so we're watching and looking what they're doing. We have speakers and we're listening to what they're doing. So we change the mannequin depending on what they're doing. There's obviously a protocol and stuff that they should be following, but if they do mess up, we let the mannequin mess up so they see what happens. So here it's not, they're messing up here before they do up on the floor.
We are accustomed to having a number of students here. We do on a regular basis. We have residents, pharmacy students, fellows. We have students from every country, almost on any given day.
I will not do the comparison between Morocco and the United States, but here, for example, there is, I think, 12 patients and nurses, I think that's one nurse for 2 patients.
Yeah.
And all about monitoring a big team.
Yeah.
So
this particular approach permits the person who lives in that environment, who is interested in changing their own environment, to have ownership of that change.
Yeah.
So we're providing the support that permits these young professionals to look at their community, create their own solutions, and then execute plans.
the problem is who use this technology, because in Morocco we have a lack of resources, human resources.
Yeah.
So we can implement technology, but first of all we must before using this technology learn about it. So we must have an education or instruction about this technology.
I think it would be very beneficial if you can give us some hints or tools about how to approach people and how to be able to bring your idea to life.
Okay. You are all humanitarians, all of you. And you have one thing in kind: serving humanity. That is the bottom line.
الدكتور هارولد روبلس المؤسس ورئيس معهد المعارف الطبية قد كرس حياته من أجل تعزيز التثقيف في مجال الرعاية الصحية كحق من حقوق الإنسان. الدكتور روبلس حاصل على درجة الدكتوراه في الصحة العامة، وقد عين مؤخرا أستاذ الصحة العامة في الكلية الدولية الأمريكية.
Street children were operated on, cut open, all the body parts taken out and sold, and then buried. And I stood in front of the president of the country and I told him, you are abusing the rights of children.
I have a dream that the church and the mosque can be united in one single institute that is concerned with public health and promoting health education in the
Morocco has started with the Murshidat, the leaders. They hired a lot of women with degrees of religious science, and she hired them in mosques, so they have to speak with women and to explain everything for them regarding education, their health.
Basically what is happening is that the resident, the intern or the resident, is presenting the patient to the attending. And they're basically given a 24-hour, like what has happened in the last 24 hours since their last round in the ICU. And so they're taking that, they're talking about the patient, and they're deciding on the plan for the next 24 hours.
القسم بالنسبة لهؤلاء الذين يعيشون حياتهم في محور هذا المبدأ ليس مجرد مجموعة من البيانات أو مجرد مجموعة من القواعد التوجيهية. فالقسم ببساطة هو المعنى التوجيهي في حياتهم اليومية.
Human beings share universal values. Everybody tastes compassion and mercy and patience and understanding. Everyone cares about freedom and justice and love and tolerance. Now, to different degrees. And people who are motivated strictly monetarily or politically, well, then we see a lot of corruption comes in. But the average human being, people to people, they care about the future of their children, the food on their table, the quality of life that they have. So that means we have to address food and water and rights of individuals, but from what basis? Universal values.
Sharon and I have done some programs that teach people how to help moms in labor to decrease pain and deal with pain and position change and comfort measures. And so they wanted to do that to encourage moms to come to the center to give birth, to make it a better, a more welcoming, I guess, place.
In areas where the healthcare provider is male, And even if you have a very motivated person, there is always the barrier of culture and tradition, that they are not, able to get that message across.
Right now we're allowing the students just to kind of walk through and put their hands on stuff and just allow them to kind of work through some stuff.
هي حاجة جميلة جدا.
They're not looking at us in a different way because maybe like we're Muslims or veiled. No, it was very friendly and everyone was.
It was good to know.
Yeah.
خليل جبران الكاتب المشهور يقول: العمل بإخلاص هو الحب المرئي الذي يراه كل الناس، ولذلك يجب أن نسأل.
We have the same principle in the life, working, having nice time with the family.
Yeah.
Yes.
هل من الممكن للإنسان أن يعيش هذا القسم في حياته اليومية؟ للإجابة على هذا السؤال قمنا بزيارة لباحثة الطب المغربية إيمان مع عائلتها الأمريكية المضيفة.
Did you tell Iman about the guy who asked if there was halal pork?
Yeah, in our orientation meeting with Legacy International, we were discussing the food aspects.
One of the hosts asked that.
Yes, and
yes.
they mentioned the Muslim, they won't eat the pork.
Never eat pork
products.
They know well their class.
Yes, but then someone raised their hand and said, "Well, is there halal pork?"
They have to satisfy us that the person who's applying is really eligible to receive this very big opportunity. It's like receiving a big scholarship. They should be somewhat of a leader in their own community, so we don't just accept anybody because we're interested in them receiving some more skills and then adding to what they already know, so when they go back we can create this multiplier effect and they can help in turn the people in their own communities.
لقد حان وقت الوداع للزمالة المستضيفة والعائلات الأمريكية المضيفة، ويا لها من لحظات سالت فيها الدموع. تتطلب هذه المنحة الجامعية من جميع الطلاب العائدين بالعمل على تحقيق مشاريع للرعاية الصحية التي تتفق مع المستوى المحلي. لدعم تصميم وتنفيذ المشاريع المحلية، ليجاسي الدولية تقدم منحا اختيارية مصغرة. المهنيون الأمريكيون يقوموا بتقديم الاستشارات المتعددة وجلسات خاصة.
احنا بنرحب بضيوفنا ليجاسي انترناشونال في مصر عموما وفي امبابة خاصة.
الحقيقة ليجاسي ادتني شرف ان انا فعلا ان انا اسافر للمنحة دي، وده زود عندي مهارات كتيرة.
الآنسة ماري سمير تقود التدريبات وتنظم ورش العمل للتغلب على القضايا الثقافية لتعليم الشباب والنساء أهمية الصحة الجنسية وكذلك العنف ضد المرأة. وقد ركزت ماري معظم نشاطها حول طبقات مختلفة من القاهرة إلى الصعيد.
نو يعني لا بمعنى كلمة لا، فاهمين الفكرة؟ فهي تقصد كده، تقصد إن المجتمع كله مليان، مش إحنا في مصر، في أمريكا هنلاقي، في أي حتة نروحها هنلاقي، بس أنا في إيدي مفتاح قراري، أنا اللي أقدر أحافظ على جسمي، أنا اللي أقدر أحافظ على نفسي، وأقدر إن أنا حتى لو عايشة في بيئة صعبة، أنا بإيدي أقدر أغيرها.
فالبيت ده انا اتفضحت او اتشهرت في وكل ده، والناس كلها عرفت ان حصل لها قضيه تحرش. يعني ما بتبقاش جوه الاسم بس، مفيش اعلان مفيش حاجه، لا بالعكس، ده الاعلان بيدخل وسلاح.
انا اخصائيه صحه جنسيه وانجابيه، طبيعة الشغل في الصحة الجنسية بالأخص بتبقى صعبة، لأن الجنس في مصر عبارة عن تابو، ما بينفعش إن أي حد يتكلم فيه. وصعوبة إن أنا أتكلم في الموضوع ده في مصر، مش لأن كمان ده مجرد تابو، لأن أنا كمان بنت مش متجوزة، فده مديني وصمة أكبر. علشان أنا بنت مش هقدر أكمل تعليمي، علشان أنا بنت مش هقدر إن أنا أعيش بكامل المساواة، وإلخ إلخ إلخ. فقلت في كلمة مشتركة هنا هي علشان أنا بنت، فقررت إن أنا أمسك في الكلمة دي وأقول لا بالعكس، أنا علشان أنا بنت هخلي البروجكت بيتكلم علشان أنا البنت، لكل بقى الحاجات الإيجابية مش السلبية اللي كانت بتيجي في بالي. لو أنا عشان أنا بنت أقدر يكون لي دور في مصر، عشان أنا بنت أقدر إن أنا أغير في المجتمع اللي أنا عايشة فيه.
هي الفكرة بتاعت المستشفى جت في دماغ دكتور واحد من دكاترة معهد الأورام من 15 سنة. كان دايما بيفكر في التطوير، بيفكر ازاي ممكن يخلق بيئة أحسن للمرضى.
الدكتور أحمد الفار يسعى لمعرفة المزيد عن التشخيص والعلاج عن طريق تكنولوجيا الاتصالات السلكية واللاسلكية.
دي كانت بداية من 20 سنة. بعد كده فكر يكبر اسم البيدياتريك أونكولوجي في معهد الأورام، بدل ما كان 5 سراير بقى 50 سرير.
إضافة لذلك هو الوصول للسكان في المناطق الريفية والمناطق البعيدة، وكذلك تطوير برنامج الكشف المبكر للوقاية من سرطان العين في مرحلة الطفولة.
The great thing about this program with Legacy is, yes, those individuals have come here. We have provided them with additional knowledge to enable them to have more confidence and an ability to look at their own communities and create programs.
العيان بيبقى محتاج يسمع شرح كتير وكلام كتير عن الحالة، بس هي احنا وفي عيان تاني واقف وراه ممكن يكون تعبان وبرضه محتاج نفس الارزاق، فانت بتحاول تقلل كمية المعلومات، اهم معلومات ممكن تديها له وتكون ستريكت فيها واضح جدا، وتكون بتحس انك تقولها له ان هي دي اللي هتنفعه، بس هو بيبقى محتاج اكتر، محتاج معلومات الابسط، التفاصيل، الديتيلز، كل حاجة. ما احنا ده اللي احنا نفسنا نعمله.
فكرة المستشفى بدأت تكبر وتكبر لحد ما بقت المستشفى سرطان الأطفال 57-357.
I feel like I'm seeing a slice of the Moroccan family life, not something touristy. Yeah, but seeing how Moroccans live every day.
In my training in Caribbean Clinic, I saw many services: antenatal delivery service, breastfeeding service, and I was very impressed by the way of communication between professional health and health professional and between patients.
نحن نتتبع بعاداتنا وأفكارنا الشخصية، ولا شك أن هناك عادات وتقاليد لا تليق في المجتمعات الصحية. تغيير ما نعتقد عن أنفسنا يضطرنا لتغيير العادات السيئة.
What I believe. Since you chose to be a midwife, you have to deliver the message. You have to respect the woman's privacy. You have to do your job with conscience. Otherwise, we have no space for such midwives. They demanded us in the application to come up with some kind of project that you can implement in your region. So what I thought about, because of I thought that the very interesting idea would be to teach traditional birth assistants how to assist the delivery, how to distinguish a normal birth from a complicated one. In case of a complicated delivery, you don't get help. You have to call the ambulance yourself. You have to prep the woman for transfer. You have to convince the family of the importance of transferring the woman to higher level of care. You have to do everything by yourself, and you have to accompany the woman as well.
Yeah.
So it's really a lot of work, and what really frustrates me is that you do not get any kind of help.
Thinking that what you would be doing is not only training midwives, but then you would be reaching the moms, and then the message could get from the moms to come more to the center, and the midwives would be trained to not only provide the medical care, which they are quite capable of doing and quite good at doing, but provide the support care.
It could be billboards, or it could be some type of public service announcements where the women could see this, hear this, and see the need to come to the birth center. But I think it has to be a hand in hand. You want to have a safe environment for your birth center so that women will want to come.
The more I'm doing this work, the more I realize the essential importance of public health as an umbrella topic that covers under it many other facets, and it binds people and links people together. It's a subject that doesn't know borders. It doesn't really apply to just one ethnicity or one religion, and I think it's one of the best initiatives that the U.S. government can take.
You can educate them to come, but at the same time work with the midwives to create a softer side, to create a place where women will feel like, you know, this is a safe for me to be, to kind of bring home some of the home-like things. We talk about that a lot in our childbirth classes. How do you bring maybe some sense from home, be it a pillowcase or having a support person there, someone that can empathize with that woman to where she feels that she can relax and give birth there. So I think that much of what they're doing would complement what you're striving to do as well.
Americans have an amazing ability to be welcoming and to be hospitable and to show their warmth. And that's what our North African delegates are pointing out to. They are just very impressed by the hospitality and the openness and the generosity of spirit that they're receiving from the American counterparts here.
The Community Health Initiative, to me, is one way that embodies everything we do. Because if you think about what community health initiatives have to deal with, they're dealing not only with diseases like HIV/AIDS or hepatitis C, you're dealing with women and children's issues, pregnancy issues, you're dealing with food, almost everything that we do, leadership, NGO development, capacity building, citizen participation in their own well-being, because one of our mottos is help me to help myself.
ساعدني لمساعدة نفسي. هذا هو العمل الجاد لأي منظمة مهنية. لذا يجب على القسم تجسد المعنى من خلال الاستخدام.
I know that MKI cannot change the whole world, but every day we are training 10, 20, 30 people how to take care of their own health and the health of their community. That is what I call making a difference.
I am working on creating a different mindset for them in terms of how they should think about their projects, how they should think about all the different steps that are involved in project planning. And this is a very new way of thinking for them. It's a way to show them how in the American mindset we think about project planning step by step. What are the resources needed, exact budgets that's needed, the personnel, the staffing, all of that. So when they go back home, they will have a concrete plan that they can start executing once they go home.
What make two American nurses leave their home, coming from the United States, and come here to Morocco to do that? Why?
She touched our hearts. She did as well. She touched our hearts.
When you meet someone like Aisha and Fatima, who are doing everything in their power to create a safe, good birth environment for women, and yet they have so many challenges, it is so inspiring to us.
Yeah.
And I think, I know for me, it makes me want to do more.
The projects also, I'm trying to tell them not to be too ambitious, something that's concrete, that's realistic, that's doable, that has a beginning and a middle and an end. That's what I'm hoping that they can achieve.
Right now, the project is on its way. And basically, when I contacted the local association that I will be working on, and I explained the purpose of the project, they were very excited. And the project, by the way, is about really trying to look inside the community and find people that are motivated to do the education to their peers.
This is one of the biggest requirements of this grant, is for the fellows to return home and to gather all of the information they have acquired here in this country, and to go back and to help their fellow countrymen through a project that they will be implementing.
الرعاية الصحية هناك احنا بنسميها patient centered. يعني المريض هو أساس العملية، هو جوهر العملية. الكلام ده احنا هنا بنحاول نمشي عليه في المستشفى، يعني هناك هناك في امريكا رضا المريض واهله عن الخدمه ده اهم حاجه، مش عشان انت مستشفى مجاني، وده اللي احنا بنحاول نراعيه هنا في المستشفى. انت اول ما دخلت لقيت حق المريض، حقوق المريض محطوطه، وده احنا ووك اور توكس، بنسير على كلام.
خير من العلاج، ده شيء مهم، وده هيحل لنا مشاكل كتير قوي في مصر. كل واحد يركز يبتدي بنفسه. انا مش طالبين ان حد يعمل معجزات او ان هو يأثر على بلد كامله، تغيير يعني، هو ده الفكره ببساطه كده.
Thank you.
We'd like to give them back
by name Laila, Mitra, of course Mr. Rash. Thank you. Max, yeah.
Kevin.
And Kevin.
Everybody. Barbara.
And you.
And Taya.